Hello there. Thank you for staying with us and welcome to Channels Beam on Channels Television. I'm Victor Matthias. Now, Nigeria's COVID-19 cases have been rising since the index case was recorded in February 27th, to be precise. Since then, lockdowns have been imposed, which is now gradually being eased. The gradual easing, however, has come with more infections recorded instead of otherwise. On the program today, we will be examining what could have gone wrong and what can be done to reduce the numbers. But before we begin, let's take a look at what made the trends in the past week.
New details of alleged online fraudulent activities of Ramon Abbas, popularly known as Hush Puppy, emerged as further investigations commenced after his extradition to the United States. Some of the revelations blew Nigerians away, including the botched plan to scam an unnamed Premier League of the sum of £100 million.
Oh, don't leave me. Yeah, what you got?
Hey, I got a note. I got a pad. No pad.
Oh, don't leave me.
A new challenge has erupted on social media, one that many have said requires you to be very clever. It is basically a pun challenge, where an individual and maybe some friends make clever puns before going bonkers afterwards.
What is this? Ezemo, this is Anto. What is this? That's envelope, Ezemo.
I couldn't but help laugh at some of those puns, of course, but you can be a part of the program from anywhere you are around the world. Just tweet at us at Channels TV, at Channels Beam, at Victor_MBIDI. You can also use the hashtags Channels Beam as well as easing the lockdown. But joining us to look at today's topic, we have with us in the studio right here in Lagos, Ayobami Ladipo, also known as Mr. Porsche. He is a media practitioner, a CEO of Porsche Classy Media, a public affairs analyst, and a businessman. Thank you for joining us on the program.
Thank you for having me.
Of course. We also have joining us via Skype, Tade Ajao. He is a medical doctor based in Lagos. He's a writer and an avid observer of the COVID-19 global outbreak. Dr. Tade, it's a pleasure to have you on the program.
Thank you. It's my pleasure.
Of course, you're welcome. And also joining us from our Abuja studio is Dr. Adam Daoud. He is a public health specialist that strives in search of quality of holistic health care, as well as factors that deter safety of well-being. He is currently serving as one of the facilitators of case management at the NCDC on COVID-19. He joins us from our Abuja studio. It's a pleasure to have you on the program, Dr. Daoud.
Thank you very much.
Indeed. So kickstart the conversation for us, Dr. Daoud. I mean, so the numbers just keep rising, and we perhaps are in, we've been easing the lockdown that has been put in place to ensure that the spread of the virus is curbed. But that, be that as it may, we're still having, the numbers are still rising. What is going wrong?
Thank you very much. The COVID-19 cases have to be rising because at NCDC, there has been proactive steps to actually expand the testing focus. Ab initio, only 2 states were testing, and that affected actually how we'll be able to pin those that are positive. As I'm talking to you now, we have about 34 or 35 states that are already having the testing machine. And symptomatic cases, associated cases that are suspected are all being tested. And it is actually a very good applause to us because as at now, we are able to know how to actually manage cases better than 2 months before. And we're able to provide absolute testing and our lag time that we do have before on getting results has actually been reduced.
So pretty much you're saying, sorry, doctor, let me butt in. You're saying that we have a number, it's because we have more testing centers and also the time at which the results come back in is one of the reasons why we're having higher numbers.
Yes.
All right, so...
And you should not forget that initially, we were not able to actually pin many cases because testing was a big problem. But now we are able to, and as we are opening borders, reducing the lockdown procedures, we expect to see more cases. However, as time goes on, it will check itself because more measures on infection prevention and control are already being known and people are already practicing.
All right, let me hold you there for a bit, Doctor. I'll come back to you, especially on the prevention measures that you said, are being in place and people are putting that into practice. Let me come to our Lagos studio where we have Mayabami Ladipo. So these prevention measures now, I mean, it's been out there, but let me just restate. Wear your face mask, maintain social distance, just like we're doing. Wash your hands, use hand sanitizers. We're doing all of this, yet the numbers keep rising, apart from the fact that we have more testing centers.
Okay, let me start here. That unfortunately, Nigerians never took this serious all along. I think till the end of May, then coming into June 2020, they never took it serious. June precisely made Nigerians aware that COVID-19 is real, in quotes. Because as of February, March, you would hear people on the street tell you it is scam, it is government this, it is government that. Some even tell you it is not the same COVID-19 that is in Europe, that is killing people, that is here in Nigeria. Several people felt it was malaria. People were treated for malaria because they had malaria symptoms. So now, when you're talking about measures, the preventive measures, how many Nigerians are actually serious about the preventive measures? Maybe until government decides to, is there anything called over-sensitization? Maybe no. You can only do as much as you can. But I feel that there should be some measures, even when it comes to, there's supposed to be a ban when you don't wear your mask, but we do not really see that happening. I think I saw a release yesterday that from today in Lagos State, when you don't wear your face mask, there's going to be either a 6 months imprisonment or you're paying a 20K fine. Maybe that would work in a way. Now, when you leave the face mask, what happens to people who board public transports? Are these NURT guys, are they supportive, are they cooperative to this fight against COVID-19? Because they're only concerned about their pockets. Regardless of whatever we read on the pages of newspapers, these
they want to carry
people,
more passengers.
I've interacted with people who use public transport, and I can tell you that they are not observing these strict measures. No. So these things, it starts with we as individuals, even in our own houses, for us to understand that there is a pandemic that is extremely deadly, that can take lives, so that we don't get to that point of the, what's it called? There's a second wave that I think they are experiencing in America right now. As much as I'm not a medical practitioner, but we read these things and we have a little bit of understanding.
Yeah. All right, talking about that understanding, let me bring someone who understands, which is Dr. Tadia Ajao, who is joining us via Skype from Ibesha in Ogun State. Doctor, so talking about understanding these measures, for some reason now, it seems for obvious reasons, actually, some people are not putting into practice these measures that the NCDC, has given for people to follow. What can be done apart from the fact that, okay, maybe like a task force is constituted, like Ayobami is proposing? What else can be done to ensure stricter compliance for these measures?
Okay, thank you. What could be done right now? You're considering the restrictions that are already clearing up, and the lockdown that's pretty much disappearing. I believe government should try to put people in that would be task forces, the police, most likely a COVID-19 task force something that could, a task force that could actually be at places, public places, very public places, where there's going to be a lot of gathering, ensure that people are actually wearing their face masks, that businesses that require people to come into their buildings or structures, that they provide, washing facilities and washing facilities. Then I think to a large extent, not everyone is actually has the access to proper face masks. There's a whole lot of face masks out there, that are really not they're not very effective, right? A lot of very ineffective face masks, and perhaps more enlightenment via public media, to get people to use the appropriate face mask, to get people to try to sanitize more. And there's also the with the Nigerian problem, of accepting of changing. It's a world problem, but the Nigerians are more averse to change. They're more averse to public health changes.
Well,
so
let's hope we accept this change. I mean, this, because as it is now, the sooner the better, because the numbers just keep rising. Just hold it again. I'll come back to you. But let me go back to our Abuja studio where Dr. Dawood is still there. So, Dr. Dawood, speaking about these measures that have been put in place, and like you rightly said, the numbers are rising because we have more testing centers and all of that. What would you be proposing? Because as it is, some cities around the world that are having higher numbers are returning their lockdowns. Are we going to see something like that here in Nigeria? Or would you be proposing something like that?
Well, to be very frank, it will not be of any advantage to have another cycle of lockdown. But be as it is now, the community transmission is what we are seeing. And government has actually gone extra steps to reach to each and every individual within the community and within their houses for more awareness on this COVID-19. The National Primary Care Development Agency has actively sensitized all primary health workers, which are functional and available in all the 774 LGAs that we have in Nigeria. And we are using a lot of experiences that we have gained in tackling other disease problems like polio, Ebola. So the polio structures that we have used, they are already in place at the LGA levels. I'm quite aware that the National Primary Care Agency have finished sensitizing all primary care workers along with their supervisors at the state level, and the community mobilizers are out there working out to make sure that people know what to do to prevent themselves against this virus.
All right, let's hope that doctor. Let's hope that people will follow. People will follow. I mean, people have been following, but let's hope that they follow again to the letter to ensure that community spread that you're talking about, doesn't persist. But in the meantime, just hold your thoughts. We'll take a break, and we'll be back in a moment to continue this discussion. Please stay with us. Thank you for staying with us. We still have with us our panelists in the Abuja studio, as well as right here in Lagos as well, also via Skype. But just before we went on the break, Dr. Ahmed in our Abuja studio was talking about what can be done to ensure that we don't have more cases. But doctor, let me also bring this to your notice. The number of testing that we're having at the moment is perhaps not as much as one would expect, looking at the fact that you have over centers or testing centers in almost 35 states, like you said. What is being done to ramp up the numbers of people being tested on a daily basis?
Well, you see, the issue of testing, in as much as it is now more generous or ambiguous compared to 2 months before, we don't just test anybody. There must be some cardinal symptoms that a patient must have before we test. If we got testing everybody, these tests are very expensive. So, but if you are a suspected case, primary suspected case, we try to test you, and if you have the symptoms, obviously we will test.
All right.
Now, be that as it is said, remember, many people don't even believe that COVID-19 still exists, but it exists. Most of the people that have these symptoms, on testing them, they come out positive. And appropriate measures are being taken so that they will be treated.
All right,
And
let's doctor, let's hope that the treatment, treatment just sets in well with people, and we don't record more casualties. But I have to say thank you, Dr. Adam Dawood, for joining us on the program today from our Abuja studio. But let me quickly also get a word from Dr. Tade Ajao, who's joining us via Skype from Ibesha in Ogun State. So, Dr. Ajao, looking at the fact that community spreading seems to be the major part where people are contracting this virus, and it seems some people don't even believe, like he just said. Now, some people still don't believe that the virus even exists. Earlier on, you talked about how we can sensitize more people, but that apart, what else can be done? What measures should be put in place? Because as it is now, we need more measures to be put in place to ensure that we don't have more of these cases.
Okay, the problem, one major problem with making people believe, if COVID is real, is that sometimes they actually come across people who say that they've had COVID-19, but those people they've been okay. Most people do not show symptoms, and that's actually the problem with that's a major lacuna to cover, especially with trying to get people to believe, especially with a very ignorant background or a very ignorant society. So perhaps, and there's a lot of secrecy around patients who have actually calmed down with COVID-19. Who there's a lot of patient-client.
Yeah, I was going to say, isn't that part of your code?
Yeah, it is. It is. It's unfortunate. You can't really put patients out there, without their consent. And most people would definitely not want to be out there, having that COVID-19 because of stigmatization. So it's pretty much just an uphill drive. I'm not entirely certain how we can cover up all that.
So pretty much you're saying that people should tone down on stigmatization of those who have tested negative. People shouldn't stigmatize. Instead, people should encourage them and let them know that it's not a death sentence, and just give them that encouragement and that confidence to also just reintegrate back into the society.
That's about it. That's about it.
All right, I'd like to say thank you. I'd like to say thank you again for joining us on the program, Dr. Tade Ajao. You joined us from Ibesha via Skype. Thanks once again. Of course. But so, just in winding this down, how do we get those people to believe? Because it seems that there are people who are even living their lives without all of these measures. If you go to the suburbs, so to speak now, how do we get to these people? Traditional rulers, what should we be doing? How else can we bring them into the picture quickly?
Okay, quickly. Unfortunately, like Doctor said, I'm not sure Nigeria can go through another phase of a lockdown because the economy is bad, businesses are being grounded, the educational life of students is being put on hold. But how do you go to the suburb? Now, we have a national orientation agency. So aside we using the electronic media, the social media, and the rest of it, reach out to when Doctor said they've trained every primary health centers. How about getting to like she said now, the traditional leaders, bring these people in all this community together, teach them, speak to them, the same way the message of HIV was passed across the globe. In the same way it got to every local government, into every village in Nigeria. Let people understand that this thing is real. It is deadly. It is scary. It kills within days. So it's not something that you can live with for months. Now, it is easy for that person that has gone to school to understand it and to wake up every day to take preventive measures. But to that person who does not even believe that it's real, who believes that there is a government scam or government machinery doing a government manipulation around it, we need to reach out to these people, because the community transmission that you're talking about is not happening around Lekki, Aja, maybe a little bit. But you see, amongst people who do not even understand it, who probably feed from the same plate, drink from the same cup, they go to the stream, they mix, they shake hands always, they spread their clothes at the same places. These are where we need to tackle issues.
Hopefully we tackle the issues at those places, and hopefully that would also help the numbers not to go higher than they are. But thank you again for joining us on the program.
Thanks for having me.
Marabami Ladipo, online publisher. Well, that's where we are. We'll take a look at the most viewed videos on our YouTube channel now.
This week's most viewed videos begins with the confession by kidnappers who collected a 7.5 million naira ransom, but yet killed their victims.
7.5 million. I made a mistake.
How much was your share?
Then I give me 300,000 inside the money. When I took the money, I also met this guy at Tena compound. So I gave him the money. The time he was giving me the check, he gave me 2,000 naira that I should pay my machine. But when I brought the money, he did not give me one kobo out of that money.
It is followed in fourth by burial of former acting chairman of the All Progressive Congress, Senator Abiola Ajimobi. Third spot is taken by the celebration of the life and times of late Pastor Ibidun Igodalo.
You have shown me so much mercy, much more than I deserve.
In second is the heated debate that ensued between federal lawmakers and Minister of State for Labour, Festus Keyamo.
Public hearing. If it's a private hearing, I will not speak. Chairman, you can't guide our proceedings here. You are not supposed to guide our proceedings here. If you don't want, you can go out.
While first place is taken by the arrest of Nigerian internet fraudster Ramon Abbas, popularly known as Hush Puppy.
Well, that's the most viewed videos on our YouTube channel. But just before we go, let me try my own Don't Leave Me challenge. As it is, what is this? It's a paper. And on it is news. Does that make it a newspaper? Well, don't leave me. Unfortunately, I have to leave you guys because we don't have time for more of this wisdom. Thank you very much for watching. I'm Victor Matthias. Bye for now.